Just a little more care can prevent a tragedy. Every minute, a woman dies in pregnancy or childbirth. For every woman who dies, 20 to 30 others will survive, but with morbidity, one of which is obstetric fistula. A Banner story. She labored for 3 days with hope. A Banner, a victim of obstetric fistula, is a story of 2 million women in Africa. At the age of 17, she had to walk for 3 days in labor to reach a nearby clinic. She lost her baby, later her husband and family. Ostracized by society for her condition, a Banner is alone. Every day she sheds tears of hopelessness. Many like a Banner are not even aware that this condition can be prevented if not treated. Many a time the joys of motherhood come to an abrupt halt. Obstetric fistula is one reason. What is obstetric fistula? Obstetric fistula is a hole or an abnormal opening in the mother's birth canal. This results in chronic leakage of urine and/or feces. Causes: several days of obstructed labor and no medical intervention such as cesarean section causes fistula. During prolonged labor, the baby's head constantly rubs against the birth canal. Soft tissues of the pelvis remain compressed long enough to result in tissue death. The consequence: puncture in the vaginal wall, creating a hole between the mother's vagina and bladder, vesico-vaginal fistula or VVF, or between the vagina and rectum, rectovaginal fistula or RVF, or both. This causes uncontrolled leaking of urine or feces or both. Who is at the risk of developing an obstetric fistula? Risk factors include physiological, nutritional, and socio-economic factors. Pregnancy at a young age, childbearing before the pelvis is fully developed. Women less than 1.5 meters tall are at risk. Malnutrition. In developing nations, lack of access to medical care, especially in circumstances such as prolonged or obstructed labor. Lack of education. Poverty and low status of woman reduces the woman's chances for timely obstetric care. Negative traditional practices, especially during pregnancy. Gender discrimination. Communities where women lack power to choose when to start bearing children or where to give birth. Physical and psychosocial consequences of fistula. Obstetric fistula leaves the woman with chronic leaking of urine and feces, stillbirth, abandoned or neglected by their husbands and families, unemployment. Due to the foul smell and their physical condition, they are ostracized by the society. Women with fistula are usually the most impoverished and vulnerable women in society. No time to waste. Management of symptoms begins the moment there is leaking. Insert Foley's catheter. Mobilize the patient immediately. Use a stick for support if necessary. Increase fluid intake of at least 6 to 8 liters per day. Enable free urine drainage whenever possible, preferably in a pot. Do not use antibiotics unless indicated. However, conditions such as puerperal sepsis or infection requires a course of antibiotics. Recommended oral iron preparations. High protein diet. Why suffer when there is treatment? Obstetric fistula is treatable. Reconstructive VVF and RVF surgery has a success rate of 90%. Post-operative care for 2 weeks is necessary. Counseling helps address the emotional damage and facilitates social reintegration. In case surgery cannot be done, urostomy is advised. This is a bag worn to collect the urine. Women corrected for fistula can bear more children. However, caesarean sections are recommended to prevent a recurrence of fistula. Knowledge empowers. Know more about obstetric fistula. Obstetric fistula is almost unknown to developed countries. The reason? Obstetric fistula is prevented. Every woman should know that childbearing at a young age is a risk. Childbearing just after menarche is not advised as the pelvis is not completely developed for the purpose. Malnourished women are at high risk. Risk cases should make arrangements for an institutional delivery or have access to medical services when a complication arises. Seek emergency obstetric care without delay when labor extends for more than 18 hours, prolonged labor. Initial labor pains are severe, frequent and prolonged, but later decrease and become very mild due to muscle fatigue. Pain intense on the back, radiating to thighs, rather than inside the abdomen. This is due to pressure over muscles and ligaments. Exhaustion and dehydration. High pulse rate. Dilated large intestines that can be palpated, giving off a hollow sound. In the event that prolonged or obstructed labor results in obstetric fistula, surgical repair is possible. What midwives need to know. The community midwife is trained to provide normal antenatal care. However, during emergencies or lack of timely medical care, the following do's and don'ts are useful. Midwife's checklist to detect obstetric fistula. Leaking begins soon after childbearing. Labor was prolonged or obstructed. Woman is malnourished. Adolescent mother. The best childbearing age is 20 to 35 years. Obstetric fistula prevention. Assesses risk of the woman. Help chalking out birth plans, where and how the delivery can be carried out. Emergency preparedness plan. Early detection of potential cephalopelvic disproportion or malpresentation. Women at risk should be urged to have an institutional delivery. If institutional delivery is not possible, make arrangements to reach a healthcare facility when there are signs of prolonged or obstructed labor. Insert Foley's catheter in case of prolonged labor. Caesarean section must be done in case of prolonged or obstructed labor. Obstetric fistula treatment. Vaginal examination. Look for an abnormal opening in the vaginal wall. Palpitate using finger for signs of any abnormal opening in the vaginal wall. If a fistula is detected, insert a Foley's catheter into the urethra immediately. If possible, carry out the methylene blue dye test. Inject diluted methylene blue through the Foley's catheter. A cloth placed in the vagina turns blue, confirms fistula. Debride. Remove necrotic tissue. Sitz bath for perineal care. Foley's catheter is kept for 4 weeks with a weekly reassessment. Encourage 6 to 8 liters fluid intake and a high-protein diet. If there are no signs of healing, debride wound and slough. Mobilize patients at all times. Attend to all other patient needs. Contact a fistula repair center for further necessary steps. Just a little more care can prevent a tragedy.